Good morning, everybody, and welcome to the subgroup for legal and financial barriers to aging in place. I'm Krista Griffith, co-chair of this working group and also of the subgroup, but I'm also co-chair of the overall working group. With me is my co-chair, Julie Devlin. Hey, Julie.
Hey, everyone.
Tell everybody who you're with, Julie.
Sure. I am a senior planner and the legal services developer with the Division of Services for Aging and Adults with Physical Disabilities, or DSAPIT.
And I represent the 12th district, which is in the northern Newcastle County. Both Julie and I are attorneys. And once upon a time, I served as chair of the Senior Protection Initiative at the Delaware Department of Justice. And I do know that Julie is on that currently. So those are our backgrounds, I believe, while we are leading this subgroup, which I'm really, really excited about. And I see some new faces. So we're going to, this is our second meeting. Our first meeting was 2 weeks ago. We're going to try to keep these meetings to a Monday at 11 o'clock, not necessarily every other week, but that's typically the time that we feel has worked out best for everybody. But we have three new faces with us this week. So I will start with who I see, which I thank you very much for joining us. We're excited to hear your input. I do know Julie already sent me some information, I believe, from William and Catherine. So let's start with Catherine. Catherine Reed, welcome. If you could please just introduce yourself, tell us what you do for in this area and the space, and also why you're interested in being a member of our group.
Well, thank you for having us. I work with Bill Earhart. We are elder law attorneys, which means we do estate planning, but also elder law, which of course is broader. And we help families manage incapacity and provide a plan for paying for their long-term care. And the reason I'm interested in this was like, manna from heaven. I was just so pleased to be a part of this because I practice in this area because of things I went through with my family and the societal need that I see. Increasingly, our clients and families are the sandwich generation, and we just really understand what people are going through, and we'd like to try to fix things at the societal level to make it better.
Thank you, Catherine. And Bill Earhart, welcome. Next to you, please.
Okay, I was challenged for a moment to find the right unmute button there. I was just given too many choices as well. As I'm Catherine, whose nickname is Kylie, the way my nickname is Bill. So we practice elder law. Our core mission is to serve the elderly and those with disabilities. I've practiced law in Delaware for shockingly close to 40 years right now. I was a deputy attorney general for 5 years, doing mostly consumer fraud and white collar crime. After a number of years doing litigation in private practice, I just really felt both an emotional and spiritual connection to the elderly, and I shifted my practice beginning in 2006, which was a fortuitous time. The Medicaid laws changed at that time, made it very difficult for people to qualify for long-term care. Medicaid and still preserve assets. So that segued from just serving the elderly in the context of Medicaid to those with disabilities. So I'm very interested in that. I've served on legislative committees in the past, so this is an area that is very concerning to me, and very hopeful and privileged to serve on this committee with you.
Thank you, Bill. And Kylie, is it Catherine? So you go by Kylie? K-I-L-E-Y?
Close, K-Y-L-E-E. But
Okay.
If you forget, it's okay.
Okay.
Mainly it's if Bill refers to me as Kylie or Julie, you'll know who they're talking about.
Okay. Okay, very good. And welcome, Jerry Kunzelman. I know you weren't at our last meeting, but have been a member of this subgroup. This is just our second meeting, so we're just still in the sort of getting started process. So welcome if you could please introduce yourself and tell us your background and why you're interested in working with us on these important initiatives.
Thank you. Yes, I'm retired. I live in North Wilmington. I'm not currently working. So this is an area that is something that's happening in my life. I'm starting to plan for it. My background is when I worked, I was a vocational services director in upstate New York. And I started as a special education teacher first. I was involved in a lot of systems change in New York in my career, deinstitutionalization, which included changing funding and using funding to increase quality of life services. So that's an area that interests me professionally when I worked, and I'm looking at that now. Looking at the funding that is currently being spent potentially and how that might be utilized differently to serve some of the needs that we're talking about. So I'm excited to look at this and improve quality of life. Thank you.
Thank you. And Jamie, is it how do you pronounce your last name?
It is pronounced Ramaj.
Ramaj. I was doing long A's, and I just wanted to make sure.
Thank you. It's all I answered anything. My favorite one was Ramagi. That's
Ramagi.
Ramagi. Yeah, when we lived in Hoboken.
Jay, they can make Jay. You never know. Well, Jamie, welcome. And if you could please, because we have some new faces. Oh, here comes Amy too. If you could just same question to you, and thank you.
Sure. So again, Jamie Ramaj, I'm the owner of Comfort Keepers, which is a home health aid only licensed agency here in the state of Delaware. I provide care in both Newcastle and Kent County. Also on this subcommittee from the perspective of we refer to it as DOC. That stands for the Delaware Association for Home and Community Care. So I'm the president of the board of that association. And we have board members that are attributed to, distributed rather amongst all the subgroups of this Aging in Place work group. Thank you.
Thank you very much. And Lisa, welcome. Can you hear me, Lisa Zimmerman?
Can you hear me now?
Yes.
Excellent, excellent. Good morning, this is Lisa Zimmerman. I'm the Deputy Director here for Medicaid.
Thanks, Lisa. Amy Milligan, welcome back. How are you? If you could just we have some new faces, so if you could just quickly introduce yourself and let us know who you're with and why you're with this group. You're muted, Amy.
Yes. Okay. Hi. Sorry, I was a little late. I'm Amy Milligan. I'm the Executive Director of St. Francis Life PACE program, and I'm also representing the Delaware Healthcare Association.
Wonderful. Thanks, Amy. And Olga is new. Olma, is it Bascrone? Could you pronounce your last name? Did I do okay?
You did really well. It's we call Bascrone. So yes, you did exactly correctly. Thank you.
Well, if you could, welcome to the Aging in Place subgroup. We can, so right now we're just introducing ourselves, letting us know what organization we're with and why you're interested in, what you're interested in terms of contributing to this group.
Thank you so much. I was listening in before through the other portal, but I had trouble accessing this meeting, so I'm sorry I'm late. I am the supervising attorney in the elder law program over at Classy. I represent people who are over the age of 60 with regard to their civil legal needs. So one of our priorities is to help people age in place, help people get out of nursing homes. And so I am hoping to contribute, but I know that I'm going to be successful in getting a lot of valuable information that will help me represent my clients effectively. And so thank you for inviting me.
That's terrific, Olga, and that's a great segue. I think when I think about the importance of these groups, I think of them as twofold, really. we're going to come up with some good ideas and initiatives that we will put into place either legislatively or through regulation or policy. But the other thing that we're going to be doing is getting to know one another so that when we have an individual case, if I have a constituent that calls, for example, that is in need of legal services, I know, because of the relationships that we develop here or need a home health agency, or in need of other services through DSAPID, like I have face with name, and it really promotes that Delaware closeness that we have and get to know one another to really help the community at large. So I'm excited about this work. In our inaugural meeting, which was 2 weeks ago, what Julie and I did, and in our group, we have one more person coming, Robin, we'll let her jump on with audio. But what we did the last meeting was we asked everybody to come up with sort of a top 10 to 20 of the most significant issues that you consider in your professional or personal experience to be barriers for in seniors aging in place. And I know that Amy, thank you, Amy. Amy sent me some information, and I know that Kylie and Bill did. Are we missing anybody? Did anybody else send us information? It's okay. No one's getting in trouble if they didn't. So, because it was Thanksgiving, again, we're a working group. This stuff will come in as it is, but that's the information that I have thus far. So we will talk about those today. And welcome to Robin Mooney. Robin, if you could just quickly say hi and let everybody know what organization you're with. So we have some new faces today.
Hi, I'm Robin. I was on last time. I'm just having a crazy day here at the office. I apologize. So I won't have my video on too often, I don't think. But I own Carpe Vita Home Care, which is a non-medical in-home care agency in Newcastle and Kent County.
Yeah, no, we're just thrilled you're with us, Robin, and no worries about not having the camera. I can appreciate having those days. And it is the Monday after a very long weekend.
I think that's what it is. Yeah.
Yes, exactly. We're going to let it do that. All right. We will, nonetheless, you're here listening. And
thank you. Yeah.
Thank you.
I'm taking notes. Yes.
Okay, great. So that's what we did. We looked at, let's start with finding some specific issues that we can look at in terms of addressing. Because when you're talking about legal and financial barriers, those are very broad, sweeping topics. And the last thing we want to do is have 10 to 12 meetings where we're just talking about broad issues without really getting down to the level that we're going to need to get down to really impact change in Delaware. So for the people that we care about. So we started and we had a good start. Amy sent us some information, and thank you, Bill and Kylie, even though you hadn't been yet with us, you sent detailed lists, and I did receive that this morning. So we're going to get to that in just a moment. But before we do that, I wanted to turn it to Julie to see, Julie, what do you want to add on to what I just said in terms of follow-up from our last meeting in terms of how we're going to present those issues today?
Yeah, I mean, I think that's great. If, Kylie, Bill, Amy, if you could let us know, what you sent in so the rest of the group knows as well, and we can discuss it. I would also mention at the last Aging in Place work group, so the broad work group, there are a lot of different things discussed. And there was a lot of crossover, as you can imagine, between a lot of the subgroups. And so anything that was identified as financial, which came up a lot, or legal kind of got put into our little work group. And so we're going to just make sure that we're not duplicating efforts with the other subgroups throughout this process. But I think that people are very much aware of, if it is financial, if it is legal in any way, guardianship came up, there's a couple other things that came up. We'll be looking at it in this subgroup.
Good points, Julie, thank you. So let's start with Amy. Amy, you sent a good, I'm sorry, and I'm going to credit Lisa with
yes.
with this, because this was not, Amy and Lisa worked together to come up with their priorities. So if you could review those with the group, Amy, what I'm going to do for everybody is so that you don't feel like you have to quickly take notes so that you'll lose something. We're going to, once we get a robust list from a number of us in this group, we will put a draft together so that we can look at that by the next meeting. So go ahead, Amy, and thank you.
Thank you. Yeah, Lisa Zimmerman and I had a call because we have similar probably barriers when we work on helping people in the community with Medicaid. So the first thing I think, based on the larger meeting that we had last week, the big three that they're talking about, transportation, workforce, and housing, all have financial and possible legal implications, if not for the senior, for the state or whoever is doing that. So I think that those are all areas that may touch on what we touch, what we need, what are issues for us from this perspective, but I think they're placed in the right places. So in looking at all the things, the two things that I think that Lisa and I said really need to be looked at is the area of guardianship and power of attorney. There is a process in place, but the significance of guiding them to the services and decisions that impact living in the community is huge. And I know there aren't enough guardians within the state to do that. And I know from my vantage point, and I'm sure some of the other people on here, the difficulty of individuals without family support to obtain assistance with all the tasks, the tools, the decisions, and everything they need to do to make a decision or to be able to achieve their goal of maintaining the last phase of their life in the community is a critical area. So I really feel like Lisa and I both really feel that that's something that we need to take a deeper look at. And that the other piece of it is there are so many current processes and resources, because I looked from my vantage point about, even the what happens when somebody goes into a PACE program or into a community-based program, what happens with their home and the significant financial impact to them. We also a lot of times have people, and these are all things that I think the state knows and we talked about before, not sure we can change them to date, but things such as, we have a lot of people that are just a little bit over assets. We're not talking thousands and thousands, just a little bit. And it's the only savings they have. And so in order to be in the program, our particular program, they have to spend down. So I think there are some areas to look at and see, and it impacts financially what we can do as a state, but I think it might be worth looking at some of those things. But overall, I'd say a big hurdle is not having somebody to help you make decisions in which is a very hard system to wade through.
Thank you, Amy, and thank you, Lisa. Amy, when you say this, going back to your first point, and I will open this up for discussion and questions from our colleagues on this Zoom, not having people make decisions, is it that people have their loved ones are spread thin, and that there's like, for example, like if you have a senior who has accounts at different financial institutions, they need to have those not even a power of attorney, but even if they're a power of attorney by each financial institution. Is it that the family doesn't know what's expected of them, and so instead of like from the get-go, and so it's hard for them to get a family member to stay consistent? Or is it just not having anyone at all to help them? Because I think sometimes it becomes overwhelming for the caretaker, because they think they've done X and then come to find out they have to do 17 other things, and so they're trying to plug one hole, other things are happening. What is it that you see specifically is it overwhelmed caretakers, or is it not having enough people, or a combination thereof?
I'll give you my response from my perspective, and then Lisa can kind of, I think, really give a good perspective. So it can be people with families that have no interest in being involved. It could be families that would have interest but don't have any knowledge or ability. And there is a significant amount of people that have no one. And those are the ones that are really difficult. For instance, if they're in our PACE program, part of our job is if they don't have Medicaid, we help get them into Medicaid, and we help with resources in the community as it relates to, their finances, making sure they're paying their bills. So but in those instances, because of our role, we have social workers that can kind of walk them through that. But even that's difficult because if they don't have anybody that can help them or guide them through that, it makes it very difficult because we can only go so far. And I'll let Lisa say, because she has a much broader knowledge and understanding of it than I do.
Can you hear me?
Yes, thanks, Lisa.
Excellent, excellent. So first, let me just thank Amy. I know I couldn't attend the last meeting. I had a scheduling conflict and she was kind enough to be my partner. I'm so grateful for that. Our work is very similar. The population, certainly in the PACE program, is one that the Medicaid program covers. And I think Amy did a beautiful job actually of really outlining. I think it's a myriad of problems. I've been doing this work with long-term care for, close to 32 years now. And some things just have never changed. And one of those is the folks that come to our door without family or friends, let alone family or friends who know where their resources are and how to access them and how to navigate through the system. And I think that in addition to the legal barriers of, whether you need to get power of attorney through the bank or you need to get a legal power of attorney to be able to help someone with their resources and income and potentially spend down, I think we also need to do work around educating folks about the services that we can provide for them. When we were on the larger committee and had the opportunity to listen to the caretakers, was very moving testimony from them, and just highlighted the fact that people don't know how to navigate through the system despite our efforts and outreach. We Medicaid have done a lot of things over the years to try and make it easier, more accessible, partnered with our sister agency, DSAPID, certainly, to make resources available to folks, but some things just don't change. Knowing how to access us, and then when you access us, how to navigate through that, box under the bed of papers, or the bag that somebody brings into your office and sits on your desk with all the bank statements. We've seen all that, and that hasn't changed. That still happens today. So to the extent, and I know the public guardian is very limited, due to capacity, but I think it's something that we need to explore because we absolutely see folks in the hospital who now need services in their home, in the community, and how do we get them, always our preference to serve clients in the community in the least restrictive environment, but how do we get them quickly to figure out what their resources are and help them access the services so they can return to their home and not necessarily have to go to an institutional setting. So all things that are sort of top of mind for us as we stepped through this.
Those are excellent points, Lisa. Thank you. I have a question for you. And it's probably been tried, but not without success. It's probably because individuals are in such denial about aging. Has the department ever done a try to get everybody organized sort of 5 years before they're going to get through your door, kind of a program, like when you're hey,
no, good question.
We're going to do this clinic for people who are 50 or 60 or whatever it may be to get your life in order so that you can know, so that before pre-crisis, I guess.
Right. So I can tell you that, and I see Julie smiling, so I'm sure that she wants to add some or layer in some things here that maybe DSAPID has done. But what I can tell you is one of the benefits of managed long-term care, which we turned to managed long-term care in the state in 2012, is that our MCOs, our managed care organizations, do work with people as they start to transition and need help in the community. So as we cover those full duals in the community, clients who are both on Medicaid and have Medicare, and they need service, then start to age and need services in their home, the MCOs help bridge that for them, and we do incentivize them to do that. And we also certainly share as much information as we can around the PACE program and other programs as we mail out information to folks to educate them about services and opportunities. But in terms of like holding seminars, you know, I think there have been some attorney groups in the past who have done that. Not, you know, no offense, but, you know, really not as much around my experience, not as much around how to age in place in the community and what services are available, but more about sheltering assets and income. And that is not something that Medicaid engages in. But would love to hear from Julie if there's things that I'm missing, maybe that the SAPIT does as our ADRC and that kind of work.
Yeah, thank you, Lisa. You know, our funding really is dictated who we can serve, which is typically people 60 and older. However, our leadership is really committed to being proactive. And so we're currently doing this whole aging redesign for our agency to really start providing information, referrals, options counseling to people before they need the services. And that started in the spring for Older Americans Month. We did an aging expo where I know Kylie and Bill presented at it, but we had 500 participants or so listening in virtually about different resources for people that are aging in Delaware and how to age in place. And we'll be continuing efforts like that. We're really committed, our agency, to really doing upstream work instead of being reactive to the needs of Delawareans.
You know, to piggyback on that, one of the things that the state helps us do is they have the ombudsman office. So we do advanced directives with our people that are enrolled in PACE, and they come in on a regular basis. We have a nurse or a clinical person to answer questions, and they're there, and we actually get the advanced directives into place. But to your point, Representative Griffith, I mean, none of them, 55 to 100, most of them, there's been no discussion in their home or in their home or in their house. And even if they want to, their kids aren't ready. So it is definitely a difficult thing, but it's just one of about 100 things that, you know, even if the elder person is ready to talk about what do I want this last phase to look like, it's very hard to get family to do it. And then if you don't have any family, it's even, you know, more difficult. But Julie, that sounds great, the program.
I'm wondering about primary care.
One second, Jerry. I'm sorry. We're gonna, if you don't mind, I see that Jamie's had her hand up, so we're gonna Jamie, and then put your hand, and then we'll go in order of the hands that I see go up. On the thing, but thank you. And so Jamie, and then we'll go to you, Jerry. Go ahead, Jamie.
Thank you. Something popped into my head as Amy and Lisa were talking, and I think it covers off both legal and financial. I have come across this situation on a couple of occasions where clients have not been deemed incompetent. There's not necessarily a dementia diagnosis in place, but based on, you know, our nurse's assessment, even my lowly assessment as just the owner of Comfort Keepers, I want my paperwork reviewed and signed by you know, other family members, or, you know, a power of attorney that might not have been executed yet. But it's a concern that's come up more often than not, that I just wanted to, it triggered a thought as Amy and Lisa were talking, and I wanted to share it.
Amy and Jerry?
Yes, I'm thinking about primary care. Currently, as a senior, I get a monthly phone call from I'm not sure what the term would be for the staff member who calls me, but for the last 5 years, I've been asking about aging in place during my primary care visits, and there's no information, there's no help. I've reached out to an attorney who I thought would be helpful, and completed some of the paperwork, and expected a face-to-face meeting, and pretty much was told that the planning could occur via just email, which was disconcerting for me. I did communicate with Jewish Community Center to get case management services, and I'm a bit young, but I've been trying to find out how to educate myself on this. And so with my background, I'm finding it really difficult. The information that was shared about the Spring Aging Expo, that didn't cross my medical office. I didn't have any exposure to that information. I definitely would have participated. But I'm thinking that Medicaid pays for those monthly appointments for an older person, pays for the medical staff to call me monthly and follow up. And so I'm wondering if there's a connection there that can be made.
That's an excellent point. Thank you. Thank you for sharing that personal experience. When so the JCC was helpful, is that what you're saying? They've been helpful?
Well, I went through their process and what it would look like and what the case management would cost me. I don't have family, so I would be one of, and I think about aging all the time. I'm kind of terrified that I'll show up in one of these offices, maybe catch dementia or something, and that I'd like to have that kind of paperwork be known, not a new person to someone, have my paperwork in place, understand what's going on, and talk about more than just my housing. That kind of thing.
I'm so the JCC has a case management program. So you said
right.
One that they wanted to do through email?
No, that was an attorney that when I wanted to get my will organized, and then there was a whole issue that came up about spending down or something, and it was a bit overwhelming in terms of the attorney and talking about the financial piece. With JCC, they didn't mention this Spring Expo or anything that I could educate myself on now. I was a bit young to start paying for those case management services, which were pretty expensive. And so I didn't really hook into anything that would educate me.
So these are good points. And one of the major focuses of our first meeting was really looking at communication. And I think a big problem is having so many services, but having the information be siloed so it's not getting distributed. You know, ideally you would want that expo, to be told about that expo from 2 or 3 different sources, you know, maybe the state, maybe it would be sent to all the senior centers to distribute to everybody on their list, and then maybe through your medical provider. So that's one of the things that we're looking at. Julie, did you want to add to that before we move on to Bill and Kylie?
Yeah, and I would just add that Jewish Family Services is the organization that does the case management. They're located at the JCC, and they do have a fantastic program. Unfortunately, they were made aware of the expo, so I'm sorry that the information did not come your way. I wish it would have, but they are one of our partners in the state.
Yeah, and that's why I reached out, because I had read quite a bit about them, and I've been researching and trying to figure out how to loop in, again, because I don't have family members who will be doing that for me. And for an attorney, you know, I was looking at, you know, who I could hire to follow me. So anyway, I'm very curious.
Okay, great. Thank you, Jerry. Now we're going to turn to Bill and Kylie, and Caitlin has very graciously offered to screen share, because this is a very thorough document that was provided to us by our elder law attorneys here. And so if we want to, are we at the top there, Caitlin? Is that the top? Yes, okay.
Yes.
All right, thank you. So Bill or Kylie, which one of you would like to present?
Well, I can go ahead and get
I
it
think
started.
Kylie, you go ahead. I've got a few things to say at the end, but this is.
Yes. Well, first off, each of our panelists who preceded us touched on really the meat of our list as well. And we broke our list into financial barriers as opposed to legal barriers. And of course, there is some overlap. But the number one financial barrier I see is that the problems we just discussed, as Jerry highlighted perfectly, are not limited to people who meet the financial qualifications for Medicaid or even just over. And a lack of knowledge of how to navigate the system, people not knowing how to pay for long-term care, where to even start, and plenty of people not having anybody to help them. That is an across-the-board societal problem. And it would be nice if access to education was not limited, had no financial restriction. And to the extent possible, within reason, that it not be such a bright line test for access for financial qualifications for some programs. What I'm seeing, not just in my work, but just in my life outside of work, is that seniors of moderate means or even high means, but let's say mainly moderate means, they're afraid they're going to run out of money. And while they can pay for things, technically, they don't, because they're scared. And they don't know where to go to get it in the first place. So that's just something I wanted to really kind of shout from the rooftops, that all these great things we're talking about doing for limited resource population, well, those things are good for everybody. And that's not to say they should be given to everyone, but certainly knowledge and education should be shared. I'm not going to go through every single one very carefully, but basically in-home healthcare is expensive. And for seniors who are afraid of running out of money, they just delay. And they don't know how to get it easily anyway. They don't know who to call or how to do it. And as everyone on the call has mentioned, they either have nobody to help them figure it out, or they have a daughter or son, who's busy working or whatever, and just can only do it like after hours. And whereas the senior might have time and energy to look into it, the person who's actually helping them does not. Okay. Transportation, I guess maybe this occurred in an earlier meeting, and I'm sorry that we're just joining the group, so that's why we didn't attend earlier. But once a senior stops driving, how are they going to get to where they go? And we encounter this a lot for our moderate families. These are not rich people, but their loved one doesn't know how to get any place. And it's more than just medical appointments. Caitlin, I didn't know if you could maybe move on to the next page, please. Thank you. Again, we're in the financial barriers, so we've got the cost of medications and the healthcare premiums, okay? Going to the Acme or whatever grocery store you use is more expensive than ever, and we all experience that, okay? An online economy, I live this. Not all seniors are, even moderately tech savvy, or with all the scams that go on, they're terrified to click the wrong link in an email. And so they just don't use the internet or email or whatever. And they are just increasingly disenfranchised. Just as an example, I know to make a blood work appointment at a hospital nearby, you cannot call to make that appointment. You have to do it online. And let alone somebody who's sick, but somebody who's older and doesn't use the computer, that is disenfranchisement. At least I think an argument could be made that it is. Okay, number 7 and 8, I will let Bill speak on, but he is really echoing what our other fine professionals have said on this call today. Legal barriers. This was a little harder to parse out. Our biggest one was, of course, what Lisa and Amy said, which is guardianship and powers of attorney. Okay, no doubt about it. Educating people that they need to get the power of attorney while they have capacity. Avoiding guardianship, or having guardianship and having nobody to be appointed guardian. It is a major problem. And what they also talked about, our previous panelists on this, is it's not just the legal document or the legal process of getting that person appointed. It's all the work they're going to do and that they don't know how to do it. So Bill and I just truly echo what we've been hearing from everyone. But number 9 is just basically, have we exhausted the ability to get all the money that we can? And I am not in the know on that. We just threw that question out there. Number 10, of course, is the power of attorney point. 11, this is a legal barrier. I don't, not something to take the group off task with, but something to mention is financial institutions, because they're so heavily regulated by banking regulations, have processes that don't match up easily with common estate planning devices, let alone long-term care preservation devices. And so it's just yet another hurdle for the loved one or their families to go through. They go to the lawyer, they pay all this money, they get a great plan, they go to the bank to fund their revocable trust, not even an irrevocable trust. I mean, we have trouble with just revocable trust, and they have to get a whole new account number, which will mess up their direct deposits or their automatic bill pay. So another issue with financial institutions is a lot of times they don't want to honor the powers of attorney that have been validly prepared. They say they want their own form used. Or a power of attorney that the lawyer prepared is too old. They want something more recent. So if the purpose of the exercise was just to make a list of issues in a brainstorming exercise, that is what 11 is. Next page, please. Okay. Again, 12 is the financial institution piece. Okay. Number 13. Again, if we're just brainstorming, are we looking? I honestly don't even know. I just was wondering, are issues coming up with seniors driving and how they're treated with the DMV and what are the processes and so forth? That's something that came up in an article that we researched, and it just seemed worth mentioning here. How to report elder abuse and get help is not widely known. This all falls in the navigation communication realm. Elder abuse, whether it's financial or physical. 15, again, lack of awareness. Seniors' legal rights as residents at facilities. Okay, particularly as to, if they are Medicaid eligible or they have a Medicaid application pending, they get told all kinds of things from facilities. Okay. Let's see, number 16 is this concept of there might be programs out there for the people who are, let's say, that are of moderate means, but people don't know what they are or how to get them. Okay. 17, big lack of knowledge between what Medicare covers and what Medicaid covers. Okay. 18 is a repeat on navigation is an issue. People just don't know where to go. Okay. Number 19 is a great point from Bill I'm going to let him talk about that. And number 20, I can let Bill talk about that too, but the basic point there is, you know, not always is the senior getting sound legal advice, because non-legal professionals are sometimes telling them what to do. And there's a fine line there. And for the protection of the community, we need to make sure that they're getting correct information. Bill, did you want to go now?
I have a couple of things to say that really aren't so much either financial or legal, but are psychological, I think, and sociological as well. What I see in my practice every day is that people fail to plan. People are afraid to plan, and they put off thinking about long-term care. They put off thinking about incapacity more than they put off thinking about death. So if somebody has to talk about death or talk about incapacity, they'll talk about death first. People come into my office and they begin to say, oh, gee, I want a will, which I interpret as being, I need a plan. And they always start talking about their stuff. Who gets their stuff when they're gone, which is the fun part of planning. And what we like to do is try and get people to focus on the incapacity issue as well, which is the difficult aspect of aging. Who's going to make decisions for you when you can't make them for yourself as well? So failure to plan and denial about the realities of aging as well are the most difficult things that I find in my practice. I know Olga and I currently share a client where the major issue in her plan is her failure to come to grips with reality regarding her housing situation as well. So failure to plan and denial are the greatest obstacles that I see for the elderly in being able to navigate their own way through the system. I think Krista earlier had mentioned to Director Zimmerman about does the division do anything to promote 5-year planning or things along that nature. You know, 5 years is a long time, and people even in their mid-70s will put off that. So what do I see the greatest barriers are psychological barriers or sociological barriers. People fail to plan. And what needs to be done in order to promote that, that's difficult to say. I know in a little bit, we're going to talk about Washington State Long-Term Care Trust Act, which is the effort of that state to encourage or mandate some modest long-term care coverage upon them. You know, and just reading it today, the $36,500 long-term cap, even paying for 20 hours of care a week in the home, is not going to get it for most of our clients who are out there. So a difficult issue. One of the things Congress did, and then they really sweetened the pot in 2006, is the long-term care insurance partnership program. So if an individual buys $300,000 worth of long-term care insurance, well, then they get to preserve $300,000 worth of assets before they apply to Medicaid once the long-term care coverage is exhausted. And the major problem with that issue is the major problem with long-term care insurance. It's just expensive, and people just don't want to pay for it. And I think the few people who do pay for it generally have more than modest assets. So the long-term care partnership aspect of it is not appealing to them. So certainly I would like to see what Washington State and other other government entities can come up with in the future, but mandating some form of long-term care coverage, like government mandates some form of health care, is, for better or for worse, probably something that needs to be considered.
Bill and Kylie, thank you very much. That was very extensive and extremely helpful. And I've already, because of, and Amy and Lisa too, I have, for the four of you, gotten a lot of great ideas. So that we can focus on. And so for everybody else, please continue to think about some lists and let us know via email, and we will get to them. I had a question for you, Bill, on the, I mean, I'm just thinking about this in some ways. I'm going back, you know, one of the first things I did when I became a parent was execute a will with my husband and all of those agreements, particularly when I had when the second one, we dusted that up when the second one came along and had special needs. So that presented yet another layer of protection that my husband and I needed to take place, you know. So I think we got into the practice and the habit very early on in our married life to execute those legal documents, which will hopefully be the basis for us to continue to work on them as we age. What has anything worked with some of your clients to move them out of that? What tricks or techniques have you learned to help move seniors, and anybody on this call can answer this question, from that place of denial to acceptance and move to a place where they're not failing to plan, but indeed are planning and getting enthusiastic about it because they realize the benefits that will be to themselves and their families once they're gone?
Oh, well, I suppose I have my own particular bedside manner. Once people come into my office and they want to discuss planning with me, but you have to realize, Representative, that once people either come into my office or brought into my office, that there's already been some psychological preparation or realization for that. And if anything, I've been accused of being more than direct when people come in. Using your own example, having a child with a disability is a traumatic experience. And so many of my clients who have similar situations, you know, they're already confronted with some of the hard realities of life. And, you know, say my concern is not really so much people who come into my office, but it's people who haven't come into my office that I know are going to come in. And then, you know, we just see lots of wasted opportunity for failure to plan. One of the biggest areas that we see are people who come in with inadequate powers of attorney, and they may have modest assets, but it's going to be very difficult to do something to preserve them with. And more than occasionally, we have folks coming to our office who other entities have advised them about preserving assets, and including certain nursing homes who encourage people to go and apply for Medicaid when they're not qualified. And so months are wasted before the individual elder is on Medicaid, and then the nursing home turn around and sue them since 5 or 6 months of eligibility has been wasted. So there's 5 or 6 months of nursing home costs that have been incurred.
Well, thank you. Thank you for that. Is there anybody have any questions or want to add to the conversation? Olga, I was going to call on you because I was going to, because of your experience, and I thought you would have some things to say too. Thank you, Olga.
I was wondering, really, what is the state's attitude about Medicaid planning? I would like to see Medicaid planning encouraged. The burden, the economic burden that long-term care imposes on a family is so extreme that it basically strips families of their ability to pass along any wealth to the next generation, which is not in the state's best interest, in my opinion. It seems to me that the state would like younger people to be able to receive some measure of wealth from their parents in order to be productive, tax-paying members of the society rather than pushed into poverty. So sometimes Medicaid planning gets the name of some kind of subterfuge going on or some kind of inappropriate behavior. I think it's really kind of essential if what we want to do is maintain a healthy economy nationwide. So I'm wondering, what does the executive branch, what does the legislative branch think about Medicaid planning?
Well, we have Lisa on, so I'm going to turn to Lisa in a second. In terms of the legislative branch, we respond to questions and concerns with legislation. So no opinion yet on that, but I think I'm going to turn to Lisa. She has her hand raised and she is the deputy director. So Lisa. You hear Lisa?
Can you hear me now?
Yes, we
okay,
can.
Beautiful. It's some weird combination of computer phone thing. I don't know, but anyway. So I cannot speak for the state of Delaware. Certainly would never do that. But I can speak broadly about the Medicaid program. And what I can tell you is the Medicaid program is a state and federally funded program. So we get a match for the state dollars that we spend. We are stewards of the taxpayers here in Delaware and look out for their best interest and the way that their money is spent. So I can tell you that any sheltering of assets or income would absolutely impact the Medicaid budget and therefore the state of Delaware's budget. And so just sort of, very broadly, if you shelter assets and income as a means to obtain Medicaid, then more people certainly would go on Medicaid, and therefore it would increase both the state's budget and the Medicaid budget. And so not an opinion, just really a fact.
Thank you. But this isn't, Olga, this is an issue that we can look at and focus on, is how do we encourage this, it ties nicely with the issue that raised by Bill and Kylie, which is bringing folks to the planning process long before the emergency begins. Jerry, your hand is up.
Yes, a few years ago, I can't remember, but I thought I saw an effort in the legislature to build a collaboration between mental health services and medical services in primary care settings. I know this year, I think it passed the legislature of increasing the funding for primary care, that primary care was at risk in Delaware. And that passed, I can't remember the bill, so that primary care providers stayed in Delaware. The number of primary care providers had gone down. The emphasis in primary care here in Delaware is just on medical, physicality. And I'm from New York State, and I miss New York State. I remember 30 years ago, my primary care provider had mental health staff. So when Bill's talking about people adjusting to this idea of aging, there were staff right there working with the physician, that case management staff who could, the physician, that happened in that environment. Those services were in the medical setting. I know I have one of the best primary care providers in Delaware, and I can tell you that the staff are they really don't have those aptitudes, they don't have those skill sets. They are striving to do that. I do have an email. I'm going to be attending a December 7th session that my primary care is putting together on loneliness for seniors. There was a survey done, and the seniors in that primary care grouping are going to meet. And I'm sure some of these issues are going to come up, but I don't know, 30 years ago, I saw my primary care provider providing some of these services, and everybody sees their doctor.
Thank you, Jerry. Any follow-up, Julie?
Yeah, Jerry, you reminded me, I was on a webinar and I'll have to do some research, but I know there is a program, and I can't remember in what state, where they put attorneys in primary care physicians' offices to do powers of attorney, wills, things like that. And it was, it might have been income-based. I'm not sure, because it might have been a low-income medical provider. But I'll have to do some research and share that information, because that could be a way to kind of bridge that gap of the planning that we've been talking about.
Yeah, I mean, I've been with my primary care now since I've moved to Delaware 22 years, and there's a certain trust level that happens when you see someone so often. I know in New York State, part of my vocational training, we connected the Department of Labor, I forget so we just moved teams together, and that often bridged things. I'm part of the Friends group for Brandywine 100 Library, and Dr. Annie Toman, the head of the library system here in Delaware, has talked about the libraries being utilized more in this way to get information to citizens, having triage groups within the libraries. They are now lending out tablets. I guess they're easy. When we talk about seniors using computers, they're easy user tablets, and that program is working out fairly well, so that more of that kind of system. And they're creating some rooms in the libraries for privacy, utilizing computers where someone can get an assistance at the libraries.
Thank you, Jerry. Olga, your hand is raised.
Yes. I just wanted to respond, Julie, to say that Community Legal Aid Society, and we're commonly known as CLASSY. So if anybody's talking about CLASSY and you don't know what they're talking about the Community Legal Aid Society. We have medical legal partnerships with Christiana Care Hospital, with the successor to Connections. I forget what the name of that entity is now. And I believe we have one with the Department of Health. And they are very effective in helping people with their civil legal needs, in an effort to get better outcomes for healthcare. That is just a model that is very successful.
Thank you, Olga. Amy?
I was going to say I have an operational issue and I gotta leave, but do we have any homework, or will you send that out?
Yes, I will. You don't have any, your homework will be this. The next presentation provided schedule permit is looking at adult protective services and how to report elder abuse. So what I would like you to do is I want you to think of examples that have worked and that haven't worked.
Yeah, I can do that.
I would like you to look at the website. I'd like you to find out how difficult it is, because I know I have had, and this is from the head of the Senior Protection Initiative, who in recent years has needed to give that number to constituents. And I'd like you to tell me how long it takes you to find the number to report elder abuse. I think if everyone can do that, here's a homework assignment. tell me how long it takes you to find the number to call to report elder abuse.
Okay.
I know that I have I also represented the kids department. So I have the child abuse hotline stored in my phone. And I think I'd probably have APS now on my phone too.
Yeah, we kind of have direct access because we have to use it, but I recognize in the community, it's not that easy, I'm
All
sure.
right, well, I just want all of us to do that exercise.
Okay.
Look at
Thank you, guys.
the tools. See if you use your eyes if you can. Okay, thanks, Amy.
Thank you so much, guys. Bye.
All right, so we have just 8 minutes left. So I've given the homework assignment. I'm jumping a little bit. We have 2 more things to do on our agenda. So I've just given the homework assignment. Are you good with that, Julie, with that homework assignment? Okay. And then APS will have a presentation provided they're available. The next meeting date I propose, and I know we're hitting against holidays, so forgive me if this doesn't work. If it doesn't work, we can go into January, is Monday, December 20th at 11 a.m. Just if anyone can raise their hand to see if that date works and that time works, please raise your hand. If there's a conflict, don't raise your hand. 12:20, 11 a.m. Olga is up. Jerry's looking. It looks like Kylie's raised her hand. All right, so it looks like that works for most everybody. So 12:20 at 11 will be our next meeting. Next, let's hear from Julie with a presentation. Thank you, Julie, first off, for doing that one pager on Washington State. One of the things that we're doing as part of this group is looking at ideas and innovation that work in other places to see, can we borrow or steal? In addition to ourselves practicing ideas, which is what we're going to be doing, we're going to be looking at what other things work in other places. So, Julie, go ahead, take it away. Thank you.
Thank you. And Bill already alluded to it, but so Washington State passed in 2019 the Long-Term Care Trust Act, or what they're calling Washington Cares. And this really is a payroll tax for Washingtonians to utilize in their long-term care efforts once they vest, which is like 10 years. And so the payroll tax is 0.58% for paid by the employee for Washingtonians, and that starts this January, so 2022. Or people could opt into a private long-term care insurance program instead of that payroll tax. So there was 2 options, but that opt into the private has already passed in their state. And so it's a $36,000 lifetime cap that they can use for anything in their long-term care needs. And so that could include pay for if they decide to go to a nursing home. It could be to hire an aide. It's medical and non-medical. And as Bill alluded to, it really doesn't cover an extensive period of time. And so based on a report from AARP, they believe that most people in Washington receive about 20 hours of in-home care, which is 32,000. So it would cover, a year's worth of in-home care approximately for individuals in Washington. And AARP also says in Washington, 48% of people who need long-term care only need it for a year or less. And so that would cover their long-term care needs. I think in looking at that, that might not be a proactive approach to long-term care because people typically need it for a lot longer, but only seek help when it gets to a crisis situation. And so in my mind, $36,000 is not much money when we're talking about the cost of long-term care at all. And obviously our state, the costs are a little bit different than Washington. And so if we were to look at this program, we'd have to factor that in. But other states are looking at similar type programs. So California had a ballot initiative that was looking at this. I'm not sure if it passed. Michigan and Illinois are also looking at publicly funded programs. And Minnesota is also looking at alternatives to private funding options. And so Washington is the first in the nation to do something like this. It seems promising, but because the program has yet to start, it just is starting, it remains to be seen how successful it will be.
Thank you, Julie. Any questions for Julie? I have a question.
Sure.
So it's 0.5% payroll tax. Is that passed on to every Washingtonian employee?
Mm-hmm.
And if you pay that payroll tax for 10 years, that qualifies you for the $36,000 benefit?
It's 10 years, and and I can get I don't have it in the one pager that I did, but it's working a certain amount. So it's not necessarily 10 years if you need it before that. So there's specific hours that you have to work. And so I can send it out.
Now, so you vested 10 years. If you are young and you start paying that at 20, do you have to keep paying that 0.8% till you're 60? Or is it like you pay 10 years and you've locked in your $36,000 benefit?
I am not sure. I would have to look at it because I am not sure. I'm just looking at the information.
No, that's fine. I'm asking highly technical questions, and I could look into that. I could just see that would be an argument where it would be Washington's a little different than we are here in Delaware.
The other thing that I didn't mention is that there's no guarantee that payroll tax would increase, and if it increases, that's additional money taken out of people's salaries. So
yeah, it would maybe cover a month and a half at a nursing home, or 2, maybe 3. But yeah, but again, if the idea is to have, to be as there of an assistance as a bridge to when you need to go into long-term facilities, to stay in your home, that might be a help. Interesting. That's really interesting. It's going to be interesting to watch that play out. Are there any other questions for Julie on this program? What are your thoughts? What is everyone's thoughts on this?
I was going to ask, is there anything about people moving out of the state of Washington?
Only payable to businesses, facilities in Washington state. So. Yep.
Jerry?
I was wondering about the cost of care for facility care in Washington state, if they listed that in their report.
I did not see it, but we can find that information.
Bill?
Oh, my impression was first, another socialistic program that's going to go ahead and tap my pocketbook versus cheap. This is a real cost that we already bear, as Lisa Zimmerman already pointed out. And it's as real a cost that the public is bearing as the roads we all pay through for, which is a combination of federal and state money as well. So while I'm glad to see that Washington state is actually facing up to the reality and the cost of long-term care, I think the scale on which they are attempting to address it is unrealistic, and it's not going to get them where they really need to be in the future. So that's my observation. It might be a step in the right direction. Voluntary incentives like the long-term care insurance partnership promoted by the federal government, I believe beginning back in 1993, are ineffective just because of the cost of long-term care insurance. But I think Washington state's efforts are going to irritate people and resolve it. If we were looking to do something here in Delaware, I guess Lisa Zimmerman could probably give us an idea of what the average long-term care beneficiary across the state of Delaware, but I'm sure it's a lot more than $36,000 over the lifetime.
Yeah, and I agree. And who even knows what what this is costing the state of Washington to administer? You know, I imagine a lot of that 0.58% is not going to assist the senior, assist those with their long-term care, but to actually administer the program because it's staffing, monitoring, et cetera, et cetera. So I think, yeah, it's interesting. It's good for us to hear about what these options, what's going on and see what we think. Did you, Kylie, did you have your hand raised for this issue? Okay, thank you.
Yes. Can you hear me? I wonder if a better bang for people's buck is to buy into like a JCC type place or a St. Francis type place where they are getting access to these resources, services, education, etc., kind of like belonging to a health club, basically. But there'd be a partnership between the private community with maybe a modest amount of diversion of state resources, whether it's money or staff, but some kind of public-private partnership where people buy in, like a maintenance fee or something. I'm not overly familiar with what St. Francis has to offer. I think it was Amy who's the head there, but from everything that I hear, they do great stuff. And there's lots of people who would just like access to that. Now, maybe you can private pay to be there, but someplace like that only multiplied.
Thank you. All right. I think with our time, we are now moving into our next agenda item, which is public comment. Caitlin, would you mind giving the introduction for public comment and direct us in terms of how individuals can provide public comment if they are not attendees, but not panelists today?
Absolutely. So it actually looks like we don't have any members of the public with us right now. There is one call-in, but I think that might be Lisa. Lisa, is your number ending in 8655?
Sorry, yeah.
Okay, so that confirms, yeah. So we don't have any members of the public, but for anybody who is watching this back on the YouTube recording, you can send public comments to caitlin.delcalo@delaware.gov. That is spelled CAITLIN.DELCOLLO@delaware.gov.
Thank you, Caitlin. Julie, any closing thoughts?
No, just thank you all for this very engaging conversation, especially on a Monday after a holiday. And I'm really looking forward to, again, working with you all to come up with solutions.
So for our next meeting, December 20th at 11 a.m., it'll be in this format again, Zoom, and we will send out a notice of that along with a link. And the homework assignment is to come up with things professionally or personally, questions you may have, strengths, weaknesses of the adult of reporting elder abuse through the Adult Protective Services, any specific issue that you see that there's a loophole with in terms of clients who are, being financially exploited or physically abused, because that's also an aspect of it, is the lack of care and neglect that can result. I know I had a case as a prosecutor where I had a death by bed sores that was absolutely 100% due to neglect. Horrible case. At any rate, there's a lot to abuse elderly and that deals with the family dynamic. So we will, number one, I want to know how long it takes everybody to figure out how to call the number. because that I think is that's something that should be rapid, that you should be able to access, and I don't think it is. So that's my own experience, but maybe it is. Maybe you're able to do it in 30 seconds or less, and if not, count down just for fun to see how long it takes you to get that number. And then we'll hear from hopefully the director of that division. Reach out. Julie and I can reach out. It used to be Pam Williams. Who is it now, Julie?
It's Michelle Welch, and I can reach out to her today. So I actually have a meeting with her later. So
perfect. Okay, terrific. And I know they do a lot of work, and they're very short staffed. Like there's so many. They do not have a lot of staff to work with their enormous caseload. So, but we will hear from them also, and I'm sure they'll be happy to take some feedback from this group. So we will do that on the 20th. And if you haven't sent your top priorities, please do so by December 15th to Julie and me, and we'll continue to compile those so that we can get a list together by that 20th meeting to direct our work into the 22. So with that, I'll take a motion to adjourn. Anyone? Motion to adjourn? Anyone can do it.
I'll do it. Motion to adjourn.
All right, second?
I'll second it.
Thank you. All in favor, we just raise our hands. Have a great week, everybody, and we'll see you on the 20th. Thanks a million.
bye, everyone.
Bye.